go back to contractions. How do you time them and know that this is, and this goes especially to the first-time mothers who don't know this is false labor and this is now like the actual labor. So how do you time them, or how would you say in terms of timing, and so that you know this is false labor and this is the actual labor and you need to check yourself into the hospital?
It's a very important question, but it can be very subjective because the way we perceive pain is different from one individual to the other one. It's different from one culture to the other one. It's different to the community. Some people are able to tolerate pain much better. Yeah, but for the first mothers, that's where we have problems. Primary gravidas, they have never delivered before. For the mothers who have delivered, they know what to expect, so we don't have much problems in that. For the first mothers, it's rather difficult because of the facilities. We encourage them to go, there's what we call AMAS classes. You go for the classes in the first labor and you explain still further what you expect. But labor, as we have said before, if labor is becoming, pains are becoming more regular, first of all, the timing, this labor, these pains should be more than 10 seconds, should not be more than 40 seconds, and you find the labor is regular. Initially, I would say every 10 minutes, you're getting pain which is coming, 10 is coming, and you time it. Within 30 minutes, 1 hour, this pain is regular, then you know it's labor. 2 is that your term. If actually you are at about 38 weeks, we count them in weeks, or you are well, that's what we call term, from 37 weeks, your term, and this pain is regular, then definitely this is a sign that it is labor. If you are much earlier, you may decide to observe and see whether anything will happen. But this is a sign that labor is occurring. Monitoring labor can be a bit complicated because even when somebody is admitted to the hospital, there's what we call a pathogram. It's a graphic presentation. And the midwife will be there and will be able to time how frequent is the labor coming in every 1 hour. They'll be able to time, and actually they chart, and we can be able to see how the labor is progressing, and we can be able to do examine the birth canal, tell whether it is this latent labor or it is established labor. As we have said, established labor is very important. The labor will progress at a rate of 1 to 1.5 centimeters per hour. Yeah, but latent labor, it is not clear. It can take even 20 or 24 hours. So it's very important. But the encouragement of the mother, if you're even doubtful whether it's labor or not, especially the first mother, it's safer to go to the hospital. You are told this is not labor, go back home rather than wait and get a complication at home.
All right. Okay. And then you've going back to the stages of labor. Yes, you talked about latent a little bit. So let's talk about active and transition and what exactly happens in these phases comprehensively. In the active phase and in the transition phase. What exactly happens in these phases?
Active labor, what you have said, when the labor is in active labor, the mother in 10 minutes, she'll get 2 or 3 contractions every 10 minutes. And when labor is progressing, when it's true, every 10 minutes we'll get 3 contractions. So in about 3 to 4 minutes, there'll be strong pain, which will come at least 30 to 40 seconds. Regular. They're regular and they continue. Yeah. If the labor is not progressing and mother is in active labor, for example, we say she's 5-6 centimeters and there's 1 contraction every 10 minutes, it's not progressing properly. And what will happen, the midwife or the doctor will intervene and put oxytocin. Oxytocin is a drug to cause the contraction to become stronger. Because sometimes when you get prolonged labor, the baby is at risk of getting tired, passing meconium, so we are going to intervene on that particular time. So there's a graph which shows how labor is progressing, and it's not progressing properly. There's what we call a lat line. In a graph called pathogram that we monitor. How is the labor, the contractions, how frequent are they occurring in every 10 minutes, how is the cervix opening up, and we can show graphically, and it will show us when a lat line, alert us that actually labor is not progressing properly. Then we may be able to intervene by putting oxytocin drip, and then if it's progressing more poorly, there's what we call action line, that we may have to take that patient for cesarean section. So there's a chart which is there to monitor how labor is progressing, which is very important.
All right. And then, of course, we also have stage 2, where the cervix is completely open. Yes. So what exactly does that mean, and how many centimeters does the cervix open?
10 centimeters.
10 centimeters.
Yeah. When the cervix is fully closed, is 0. When it's latent, you're saying 1 to 3 centimeters. When it's established, you're talking 4 centimeters. The cervix is fully open when it's 10 centimeters. The baby's diameter is 9.5 centimeters. So when the cervix is open, it's 10, the baby can be able to pass through. If this cervix is open 8-9 centimeters, the head is 9.5. The baby will not be able to pass through. That's the second stage. The second stage is there the mother will feel the urge to push. She'll feel like pooping most of the time, like going for a long call. Yeah, you feel that urge as she feels like bearing down. That's what you say. And most of the time they feel like going for a long call. Yeah.
Okay. And do we have instances where, yes, someone is at stage 2, but the cervix is not completely open?
No, because stage 2 is diagnosed by the cervix is open.
All right.
So if the cervix is 9 centimeters, not in the second stage.
Then you're not in second stage.
Yeah, and so the one has to be careful, especially in the mirror. If you tell the mother to push when the cervix is not fully open, then she'll have a cervical tear because it's not open. Yeah, and the baby can get distressed because you're telling us. So we have to confirm it's fully open. And sometimes it's also important, it can be fully open, but the head is still very high.
Yeah.
So we may give some baby the time, the baby to calm down, the head to calm down. Yeah.